Welcome to the L Nutra Longevity Lab series, where science meets strategy for a longer, healthier life. I'm Renee Fitton, your host and longevity dietitian and director of education at L Nutra. Every episode, we explore the latest research, expert insights, and practical tools to help you harness the power of fasting, nutrition, and longevity science. Whether you're new to wellness or you're looking to expand your expertise, we're here to empower you with the knowledge that supports vibrant, lasting health. This episode is a special one. June is Men's Health Month, and it also is Father's Day coming up. So we're spotlighting the lifestyle and nutrition strategies that support longevity, vitality, and strength in men across all life stages, from testosterone to energy levels, prostate health to libido. We'll cover it all and all of your pressing questions that you are asking. I am honored to be joined by Dr. Gio Espinosa. He is a globally recognized leader in prostate health, testosterone management, and men's health and overall vitality. He serves as clinical assistant professor of urology at NYU Langone Health, Chief Medical Officer at XY Wellness, and host of Dr. Gio Prostate Podcast. Dr. Gio's clinical work, research, and educational content on drgio.com focuses on combining natural and medical approaches to address urological conditions. So with all of that, welcome, Dr. Gio.
Hey, Renee, thanks so much for thinking of me and for having me on.
When we were talking men's health, you truly were number one, top of mind, had to have you on. You really are the expert in this space, and we're very, very grateful to have you here. So to start us off, can you just share a little bit about how your journey led you here?
So it's so fascinating, right? Sometimes things happen for you, right? I don't think that I would have initially had no interest in doing men's health and stick my finger a lot of men's butts to check their prostates and things like that. Like, who would want to do that? And then it was like all the signs kept gearing me in one direction, right? It started with a urologist I started working with in the early 2000s. During my naturopathic medical training, I saw a lot of men for some reason. And I was still very resistant. And then I was like, wait a minute, I kind of like being in this area. And then, of course, the obsessive nature that I am, I bought every single book on men's health, every research article. I just became obsessed. And it became fascinating for several things. Number one is because I am one. So if nothing else, I wanted to figure out some things for myself. Number two, it's a big open space. I do remember, Renee, I think you'll find it interesting. Everybody said, well, why are you going to do men's health? I mean, you're going to go broke. There's no way. Men don't go see doctors. Why are they going to go see you? And I kept on my path. And I was like, I don't know, but I think some men will see doctors. And it turned out that it was one of the best decisions, certainly in my career I've ever made. And that was interesting because I have a soon-to-be 13-year-old son, so I get to see men's health from his lens as well, and see like, ooh, I know what's happening here. That's a little extra hair on the armpits. You stink a little more. I know exactly what's happening biochemically in your body. So yeah, that was the journey, and I have great opportunities to be at amazing academic institutions, Columbia University, and then now I've been at NYU Langone for about 16 years.
Wow. And I mean, it's that experience that makes you such an expert and such a trusted voice in this space, and exactly why we had you here today, but certainly probably why you see so many men that maybe wouldn't typically be so consistent with their physician visits coming in more frequently. So I'm curious, why do you think men are generally perceived, at least, as coming in less frequently? And do you really feel that that is in fact the case?
Well, I have to say that yeah, that isn't the men care less about health. They care most about performance.
Hmm.
So it's all about performance. Performance in at work, performance in the bedroom, performance with their finances, until their health takes a toll, and then they're like, oh, now I'm focused on my health. So for every 100 patients I have, they all come to me because they either have a prostate issue, malignant or benign. they have erectile dysfunction. That for men, that's analogous to having cancer, for most men, in their head anyway. Of course, is not malignant. And then so most of them, well, they have kind of testosterone related to ED situation. So most of them see me for that. About maybe 1 out of 50, I would say, that see me for wellness. So when they come in, they say, "No, I'm in good health. I just want to keep riding this wave, and I'm getting older. I'm now 50, or I'm 40, and you're a trusted person," and so forth. Um, that happens not so frequently. I wish it happened more often, because the best form of medicine is prevention, as we all know. But hopefully that'll change with time.
Absolutely. And hopefully voices like yours are going to start moving that needle more and more. So, now that we've kind of covered some of the basics, what do you think are the biggest blind spots that you see in men's health today?
The biggest blind spots in men's health. Well, let's just say, because men go through different phases, women do as well. I know all about menopause because I lived through it. Not me personally, but through my wife. I was like, oh, I remember reading about this a long time ago. This is what happens. But men go through different phases, right? You have the 20 to 40, and then the 40 to 50, and then 50 through 60, 70, roughly, right? And those are different phases. So the blind spots for one of the most concerning generations, to some degree, is the millennials. The millennials are turning 40. They're about 43, the older part of that group, right? So they're going to start feeling it, if they're not already. And one of the biggest blind spots is, for example, that they're not getting a PSA test done, right? So they're not getting it, not because they're not asking for it, because they don't know what to ask for, but because, and the PSA, for the audience, is a biomarker for the prostate, that lets the physician know if there's a problem with their prostate, or possibly if there's prostate cancer. It's not the best screening tool for prostate cancer, but it's pretty good. And what I see sometimes, Renee, is way too often, is guys 43, 44, 45 years old with prostate cancer. And this could have been prevented, if they would have gotten a PSA test earlier. And the reason why they don't get it is because the guidelines suggest, well, let's not get a PSA test in men starting at 50. Certainly not men younger, because unlikely to have prostate cancer. So I think that's a blind spot there, in terms of just general screening, where it should start earlier. Obviously, prostate cancer being a hot item these days, with um, ex-President Biden having been diagnosed and so forth. Maybe he should have been on a fasting mimicking diet, I think, prior to. I think he would have benefited from it in many ways.
Probably. We should have
Um,
gifted him. No, you can't gift. You can't gift.
you can't
Man,
you can't do that. You can't.
you
Yeah,
can't do
that's
that.
bribery. Yep.
Yeah.
Yep. Um, another another blind spot is heart attacks. And you would say, well, you know that happens in older men. We all see, once I turned 40, you pay more attention. It's almost like you buy the hot red Porsche, and you say, well, nobody has this green Porsche. No one has it. You leave, and it's like, wait a minute, there's a green Porsche right there. You see some others with the same car. um, Once I turned 40, I was paying more attention, and I was like, oh, wow, so and so that I graduated from high school died of a heart attack. So it happens frequently, and the reason why it happens is because it starts earlier. So I think that men should, number one, take care of their urological health, and number two, or maybe the other way around, actually, take care of their cardiovascular health and start early. Get a full evaluation. If nothing comes up, then at least you have a baseline of what you were at 30, 40 or so. So I think those are the two big ones. I mean, we could talk about others, but I think those are two big ones.
No, that's really helpful. And I think what this prompts me to ask is, how early is too early, or is there not really a too early? And is there a generally recognized, this is a problematic PSA number range, or is it, a little bit more flexible, or should you be looking at how that's changing over time and having that sense, different biomarkers, different things. So I'm curious about that. And then how frequently should men be testing these
Very
things?
good. Um, So a man in their 40s, and let's just focus on millennial men or men in their 40s for a minute, because maybe that's a, who knows who's going to watch this, but maybe there'll be some of those. And I think it's important to address that as well, because they're all in it, right? They are their fathers, they're stressed. I know the whole deal very well. PSA in men in their 40s should be less than one. Okay. Now, when you look at the range, it says somewhere between 0 to 4. That's You don't want to pay attention to those ranges, even when it's above 4 in men that are older, because PSA is age dependent. So if a 70-year-old man has a PSA of 5, that's not a big deal because of his age, and that makes more PSA. However, what is seems to be important is that men in their 40s, their PSA should be less than 1. Because if not, that may not mean, let's say it's 1.5, and say, oh, that's low. Not for a man who's younger than 40 or in their 40s. It may not mean necessarily they have prostate cancer right away, but it may indicate, based on studies, that somewhere down the line they may have prostate cancer. So um, that's a very important point there that I think your audience should know. The other thing is, as it relates to cardiovascular health, you got to look at apolipoprotein B, APOB. And again, you would think, of course, no brainer. I can't tell you the amount of labs that I see where cholesterol, LDL, HDL, and not these other biomarkers that are probably more suggestive to cardiovascular disease or and a heart attack and even a stroke. And if I were to add one more biomarker, it would be C-reactive protein for chronic inflammation, which is, chronic inflammation arguably is one of the top killers, in the world, or is contributory to premature mortality. So, yeah, those I think that that's what men in their certainly in their 40s should do, and they got to request a PSA. Their general practitioner is going to say, "Why are we doing this?" They're following guidelines, medical guidelines, and guidelines are guidelines to guide you, not for you to run your practice in a certain way. So they have to be what I call, through my newsletter. I call these gentlemen self-health advocates, right? There is no other way, and I think they know that because they do come well prepared, and they chat GPT everything. So they know that they need to be prepared, but I don't think they know the importance of these two factors that we just spoke about.
Absolutely. So, men out there, you hit your 40s, don't be afraid to ask your physician. PSA, CRP, apolipoprotein B. Is that right?
If nothing else, I mean, there is a set, but if nothing else, that'll give you a good understanding of where you're at from a prostate and cardiovascular perspective.
Fabulous. So, if somebody does start seeing, they're in their 40s, they see over 1, or they see that their PSA levels are going up, what would be some changes that they could make to support bringing it back down? Is there a solution?
Well, first of all, and I should probably finish answering your first question, which is how often should they test for? And if their PSA is above 1, I would say that they should get it every 6 months. Maybe that's a fluke. Maybe they ejaculated 48 hours before getting that PSA, the blood draw, and there's a lot of false and benign reasons why PSA would go up. But they should get it in 6 months just to make sure, and then it should be lower than 1. If it's lower than 1, then once a year is perfect. Again, some people would say, well, why once a year? Once a year only if there's family history. No harm, no foul. Just follow it for once a year when you get a normal blood test. There's no harm in it. It's not that expensive, and it's just a blood draw. So that is key. What do you do to lower your PSA? So you don't want to falsely lower your PSA. So there are methods of falsely lowering PSA. And what I mean by that is that they may be harboring cancer, but the PSA is really low. You don't want that, right? So it's not a matter of lowering PSA for the sake of lowering it. It's a matter of keeping the prostate healthy, so that it doesn't become cancerous, and it doesn't become inflamed, something called prostatitis, and it doesn't squeeze in the urethra whereas that's the tube that brings out the urine and the ejaculate. It doesn't squeeze there too much so that men can urinate properly and not have to worry about getting up 3, 4 times a night to urinate and things like that. The PSA should correlate with proper lifestyle and good prostate health, but sometimes it's not because again, sometimes PSA is elevated for benign reasons. So what one can do? So I would say this is very important actually. Be careful with the thing that drops PSA dramatically. Typically, there are supplements out there that people take for their prostate, and sometimes they have synthetic estrogen in it. Synthetic estrogen will, once it's consumed, it causes a drop in testosterone because they work in opposites, and then a drop in testosterone will cause a false decrease in PSA. We don't want that. So anything that sounds too good to be true is probably too good to be true. So it's very important not to chase numbers. It's important to, at least from a practitioner, I want to treat people and patients and not treat numbers. If I do that well, everything takes care of itself. The person has a great prostate health, and their numbers are going to respond appropriately. So that's I think that's key there.
No, that is really important, and thank you for making that point because I think it can get really easy to just stick to these numbers and also just really get frustrated when there might be a bigger picture at play. So I want to switch gears a little bit here because I know that one of the major questions that comes out around men's health is always we always come back to testosterone. So what are the most common questions that you hear from the men that you see about testosterone?
What so testosterone? So it is it's so interesting, such an incredible molecule. So it's known as the male hormone, but of course women have testosterone as well, and women actually need it. I know again I don't treat women clinically, but I know that bioidentical hormone treatment sometimes includes testosterone, and that helps women libido and other things. Men, just for clarification, I'll say a little bit more about that. Men, so the female hormone is estrogen. Men need estrogen as well. Men need estrogen for bone health, just like women do, cardiovascular health, and for libido. So so sometimes it's like sometimes clinics play the game of how low can you go with testosterone. I'm sorry, with estrogen. And it turns out that if you try to keep increasing testosterone, but you keep dropping estrogen, the guy will have testosterone. There'll be some benefits there, but they're saying, "Oh my God, my testosterone is 1,000, but I don't feel my libido seems low. Or I don't feel sexually interested." And that's because there needs to be a fine ratio between testosterone and estrogen. Estrogen is important for men as well. That said, um, so what are the common things I see associated with testosterone or low testosterone? Was that the question? Sorry to digress.
No. This is helpful. But I was curious. I think when we think about testosterone, and I'm so glad that you kind of made this qualification here that it's more than just testosterone. But because testosterone has been so strongly associated as the male hormone, I would imagine, and I could be wrong, that many men are coming into your practice saying, I want to increase my testosterone, and just assuming that this is, the problem, that needs to be solved. And so I'm curious, when men are coming into your practice, what are their questions about testosterone and what are your recommendations there?
So one of the questions is, do I need TRT? Right? Do I need
Mhm.
testosterone replacement therapy? And the way one would answer that is that it depends. One very important thing that one needs to understand is that it's not a matter of what that total testosterone is on a blood test. It's what the free percentage is. So what am I saying here? When you look at lab work, the ranges suggest anywhere between 300 and 900 or 1,000. That's a wide range, right? And there are men that could be at 500 and like, man, I don't feel it. I don't feel the zip I used to have. I have some ED. And there are men that are at 400, even 300, and no issues. So it needs to come with symptoms. So you're not, again, you don't treat numbers, you treat people, right? So the symptoms are low energy, don't feel like they have the zip on their step. Some ED, less libido tend to be some of many of the symptoms that would prompt someone to think that they need testosterone or want testosterone. Just to repeat this very important point, you need enough. You need about 2% free testosterone because testosterone is bound to other things. SHBG is the main molecule that holds on to testosterone very tightly. And only when the testosterone is free, ready to get to a receptor, lock and key type of scenario, it's when the testosterone will work. So you're looking for free testosterone. That's the name of the game. So sometimes they come to me and they say, "Look, I have my test." I had a guy just recently, very fascinating. I'm seeing you. So what are you here for? I'm seeing you for low testosterone, right? Or my testosterone not responding. All right. I'm looking at his blood work. His testosterone is like 1200. You're on TRT, right? I said, yeah, I am, but it's not responding. What do you mean? Are you having any issues sexually? No. Any libido problem? No, not at all. I actually feel great. I'm working out just like my buddy, and he seems to get bigger faster than me. And it doesn't make sense. We're working out the same type of workout, and I am, and I'm taking TRT, so I have plenty of testosterone. What's happening? So part of that conversation was, look, are you going to compete? Are you a professional bodybuilder? I'm not. Do you want to compete? I don't. I test him. He looks physically great. He looks muscular. I don't know what's in his head. He probably have the opposite of anorexia, bigorexia, I think they call it, right? Um, I said, all right, listen, we don't want to mess with your health. He's already like 40, 41, 42. So we don't want to mess around here. You look great. Now, the why there's two possible reasons in this case why at least with optically he doesn't look as big as he could. One is that there's very little he's not recovering well, right? So there's a recovery issue. The other is that maybe he doesn't have enough androgen receptors in his muscles to attach to the testosterone because his free percent is just like 3%. And remember, I said 2% is key, and
Yeah.
his was like 3%. So what one needs to look at is, you know, do I really need testosterone? The main symptoms are, abnormal. Everybody's tired from something, but just abnormal, chronic fatigue, loss in libido. Now, for some men, loss in libido of some loss is great because they're too much of a distraction. So a little notch down is like they can focus on things. You could have conversations and meetings with decent looking people and not feel like I can't focus on the meeting and I'm closing the deal because right, this is what happened. I'm Renee. I'm giving you a little insight in a man's life so that you
Yeah.
understand how it all really works. Make sure we keep that between you and I. Okay.
I mean, I don't know. There might be a few people listening, but just between us.
So Um, so so you don't want to just look at a number and say, "Look, my numbers are low," or "Man, I thought my arms would be bigger. I think I need testosterone." You want to be very careful with it. It is a hormone, and it could, not done right, it could cause problems.
And that I think that brings up my next question, which it sounds like there is too much of a good thing here. It's not sky's the limit. There is a healthy balance. And if you could confirm that, and then also to that same coin, is TRT and hormone therapy right for everybody? And when would you start looking at lifestyle intervention? I know that's a lot of questions, but I'll remind you of each of them as we go.
You start looking at lifestyle interventions right away. So I don't, first of all, I don't really prescribe TRT. I see people who have had prescribed TRT or are on TRT and they want another set of eyes. I believe that lifestyle medicine is medicine. And I believe that once you do lifestyle medicine, and we can get into whatever details you'd like, um, the hormones take care of themselves, and everything else sort of takes care of itself. So, but that said, I'm not opposed to TRT in the right patient who is really low. And there are very few cases, but they do exist where they do all the lifestyle stuff and their hormones don't really go up to the point that's satisfying for them. So there are exceptions, and I think men could do the right population of men can do very well on TRT. Always remembering that it lowers the ability to produce good sperm and fertilization. So when you are on TRT, it may be a little bit more difficult to produce sperm cells. And so keep that in mind if the person is interested in having children. Um, but lifestyle is definitely key here.
Paramount. Absolutely. I mean, we tend to kind of fall back on that one on this channel quite often because it really is so incredibly powerful. And I do want to get to some of your suggestions on lifestyle intervention. But before we do, well, we're on the topic of testosterone. I think that oftentimes comes very hand in hand with libido. So is testosterone really the only thing with libido, or what else influences libido? And what are the conversations that you're typically having with your patients around libido?
So testosterone and estrogen ratio. So the ratio is somewhere between 20 to 40 to 1, testosterone to estrogen. Um, if it's more than that, again, you need estrogen for libido. Men need estrogen for libido. If it's low, there's a drug called Clomid that's used for fertility, and a clomiphene. And oftentimes, what you see is that testosterone goes up, but estrogen goes low, too low. And so then, like, oh, I have this testosterone. Whoa, I feel great. Hey, I got more muscle or something. But man, I have no desire to, you know, be into a relationship or have no libido. So that's important. Um, um, the um, the other element to testosterone in terms of when too much is too much, or when they're not is not a good fit, is when the main symptom, to answer your question, the main symptom is associated with libido, fatigue, erectile dysfunction, and cognitive decline. Those are the big four. Now, all these things, if it happens continuously, is more of an issue that might be hormonal at any given moment because of life stress. Look, the guy that's in the middle of moving, divorce, and a change in job, he's gonna feel fatigued, low libido, erectile dysfunction. So there's life circumstances, but once some of these things get settled, then they should expect to have the vim that they once had. So it's always between stress, which then stress lowers testosterone, and stress, life events, and then hormones after that. That's the way I would look at it.
Which brings us perfectly with the association of stress and low libido and decrease in testosterone and changes in hormones in general. What are your major suggestions and most maybe impactful suggestions in terms of lifestyle change for men's health across the board?
I have to pick one
You can pick your top three.
in this order: exercise. Um, and I think there needs to be some level of intensity for that to be helpful. So if you're doing your 8,000 steps a day, that might be good. But if it's low intensity, you're not going to get the full benefit of exercise, right? And I think that weight resistant exercise, I just heard um, the gentleman, what's his name, from the Blue Zone diet. Probably he's a big supporter, I would assume, of FMD. It's right along those lines. To
Yes,
talk
yes.
about, well, you don't really need weight resistant exercise, right? You can just do hiking, and because all these areas that we studied, they really didn't do weights. and I think I'll push back on that. First of all, it depends. If you're starting at zero and you do anything consistently, because consistency is more important than intensity, I'll admit to that. Then I think there's some truth to that. But in terms of the things that you see that contributes to decline is lack of muscle, which then means weaker bones and inability, poor metabolism, and all those things. So I do think weight resistant exercise. A close second, if not a 1A and 1B, is recovery and sleep.
Mhm.
Recovery and sleep. And then third is diet. And over 20, 30 years looking at these things closely, I probably will keep it in that order. And I'd be willing to debate that with anyone because I know the diet people like, what are you kidding me? They eat processed foods and you could get exercise and recovery and sleep can you can get away with a few things. It can, you get away with a few things. And I'm not suggesting, of course, for people to eat, processed foods. It's not, but I know that this is all very difficult and you have to meet people sometimes where they're at. And if their diet is poor and they don't exercise and they sleep poorly, I'm not touching diet. I'm not touching diet. I want them to move their body and get better sleep. And then at some point in the future, I touch diet. So those are the major
Absolutely.
components, I think. Yeah.
And I think, from my experience, they all kind of go hand in hand too. Once you start exercising more, you probably sleep better. And, once you start sleeping better, you might be more motivated to make other nutrition changes. It's interesting how they all interplay. So I personally am a big believer of start somewhere and you'll probably start seeing a lot of these other things kind of falling into place, but I do appreciate the priority there, and certainly I've been hearing it quite often, the moving up of exercise on that list of priorities, because exercise is more than just calorie burning, right? It's also about that muscle building, which we've seen time and time again. Muscle protection is so critical for longevity, and also why we're big proponents of the fasting mimicking diet, because of that muscle protection piece that sometimes gets overlooked. But let's
Let
spend
me add one other thing: mitochondrial health, which is the key here. Myokines that seem to have anti-cancer properties when you exercise, very important. Now, let me add to this because it goes along with this is the fasting mimicking diet podcast. So I want to make sure that we properly include it where we can. From a nutrition perspective, right? In terms of what I would prioritize, because plant-based, this, that, the other. The first conversation is eat 50% less. That's the first conversation, right? So if they're eating a lot of foods that are not great for them, it's like, okay, eat 50% less. And I would have them and I get them to do some fasting. And of course, I'm not saying this because you're interviewing me, but I do get them to do an FMD, maybe depending on the situation. What maybe we could go into that how I use FMD in my practice at some point. But I do have them do that because I think that then they improve their relationship with food better, and then we can talk about eat more of this and less of that. So I need to get them somewhere, and I think that one of the biggest problem with consumption with diet is that people eat too much.
Absolutely. And I'm curious, and I'm absolutely going to be touching on where and how you're using the FMD, but are you making these nutrition recommendations also to people who are not overweight, or is this only a recommendation to people who are higher BMI or higher weight?
The first thing is that this is good for your audience to know. BMI doesn't matter.
Hmm.
So the scale, that number on the scale matters less, unless, of course, you're morbidly obese. And then if you lose 50 pounds, that makes a big difference. But most people I see are not morbidly obese. Um, and so then they say, oh, I just gained 10 pounds. I don't know. You working out more? You doing more deadlifts? So what matters is body composition, which includes how much fat versus muscle you have and body fat percentage and those kind of things. That matters most. So so from that perspective, it doesn't matter because sometimes they come to me, right, and they don't look overweight, but they're slim fat, right? They're fat. once you do a body composition, they're like 30, 40% fat, but they look slim and thin. So that's what matters most. So yeah, absolutely, I will get them depending on what they're coming in for on a fasting regimen of some sort or FMD or something along those lines. So it doesn't matter. Look, I had somebody do a FMD with me. I had a group of people, and a guy say, "Look, can my wife join in?" I said, "Absolutely." He says the only issue is that she weighs less than 100 pounds. She weighs like 95 pounds. I said, well, I don't, based on what I think I know about fasting and fasting mimicking diet, certainly fasting, just calorie restriction, your body's going to kind of meet you where you're at. So you're not really going to lose weight if you don't have much to lose. And then you could still gain from all the benefits. So this is what I think I know, but please ask her to join and, we'll figure it out as we go. Lo and behold, um, her husband, who could lose a couple of pounds, lost 8 pounds. She didn't lose anything. She didn't lose any weight during that time. So whether one is thin or not, or slim or not, first of all, you got to look at body composition, and then secondly, I don't think it matters.
Absolutely. Could not agree more. Maybe I was fishing for that answer, but we'll
Ah,
we'll leave.
right, right, right.
So tell me a little bit more about how you are using fasting and fasting mimicking in your practice. Do you use water only fasting? When do you find that appropriate? And when are you using fasting mimicking?
So I don't use fasting only. I've done it. I did it. I don't have a problem with it. I just think that it needs to be under supervision with someone. So you got to go to a clinic or something. Secondly, I've done water fast, and I did it before I had kids and a lot of responsibilities. With kids and responsibilities and work and stressors, I don't want to go on a water fast. I cannot. I will not perform well. I'll be probably a bit more moody to my kids, and God forbid I see a patient that day, you know? So I rather do, and again, I say this all the time, despite the fact that you're interviewing me. Um, I'd rather do an FMD where I'm getting something in a certain amount of calories. First of all, that's been tested well, and it's a certain amount that doesn't exceed the amount that will get me out of a fasted state from a ketogenic perspective. So by day 2 or 3 or so, and I still get those benefits, but I'm still eating something where I can still be functional. And I think that for men, I cannot go to a clinic for 7 days, right? And just fast and just kind of be monitored. I can't. Many people could, and I think it's fine under the right supervision. I cannot do that, and I certainly cannot do that in my day to day when I'm doing so many other things. And one of my rules of thumb is if I cannot do something, why would I assume that my patient can do it? Right? They lived exactly a similar life or lifestyle than I do. Most of them do. So they're stressed, their work and home and all kinds of things. So I wanna set them up to succeed. And in order to do that, I think when we're talking about fasting, we do something like FMD. Now I do tell them to fast one full day from dinner to dinner a week, and that's feasible for people. And there's benefits. I think there's benefits there. So that's my approach.
Fantastic. And I'm curious to know, you said you think there's benefits. That's probably because you've seen them clinically. I mean, certainly, just from my perspective, L Nutra has done now over 40 clinical studies. There have been studies done in men's health, specifically looking at strength and performance, showing that after cycles of fasting mimicking, not only is muscle mass maintained, but also that strength is maintained. So both metrics have been tested. But I would love to know, what do you clinically see? What are you seeing when your patients are completing fasting and fasting mimicking protocols?
Well, I guess we have to go back and say, well, how am I using FMD in my practice? I use FMD with patients who are, so I see a lot of prostate cancer. So if they're going to undergo radiation, sometimes they undergo radiation for 5 days, they do FMD for those 5 days. If they do some sort of chemo in some cases, they do it once, they do the chemo once every 3 weeks. For that week that they do chemo, I have them on FMD. the benefits there is that they still feel good and not completely depleted. They are still functional. What's happening in the body, based on some of the research, I think Vulture's research as well, some of it is that the cancer cells may be more sensitive to the therapy itself. So you're not only are you taking care of the healthy cells, but you're also making the cancer cells more prone for it to be alert to chemo or attacked by the chemo or the radiation for it to do its job. So that's one benefit. The other benefit is the proper weight loss. Proper weight loss. My experience is 5 to 8 pounds, and those that need it do well. They lose visceral fat, they lose fat from their waist, and their numbers start looking better, and they do develop a better relationship with food. Sometimes they're like, "Hey, can I do this once a month?" They feel so good by doing it. So those are the main things. I cannot speak for testosterone as much because I don't measure a before and after as it relates to testosterone. I'm typically seeing people with prostate issues and are just metabolically dysfunctional. So I cannot speak for that. But my guess is, based on what I know about fasting, is that may benefit. So I would say this: if a person fasts for 24 hours, nothing happens to muscle. You may even stay plateau, or sometimes increase some of it a little bit. If it's more than 48 to 72 hours, um, at that point they may get some of those amino acids from the muscle may be utilized for energy, depending on what's the fasting situation, and if they're working out or not. But then it recovers right away, depending on what they eat afterwards. So I have little concerns about muscle wasting and a lack of muscle preservation during any type of fast. I have no concerns about that at all. But that's what I see clinically. I wish I could say that I see more erections functioning better after FMD. I'm sorry, I have not seen that. So you guys you
Yet.
cannot use that for your marketing. I'm sorry.
So what do you see actually we didn't really touch on erectile dysfunction. What do you see as some of the biggest opportunities for individuals who are facing erectile dysfunction in terms of lifestyle change?
Let me try to rank this. Number one, and one by a lot, I think, at this point, excessive pornography watching. That is the biggest issue with men with ED. It's certainly younger men with ED. I'm talking about 40 and younger, 25. I never thought I'd see 25-year-olds with erectile dysfunction. But yes, I am. I am. And I think a big part of it is, these kids were brought up from the time they were 2 years old with a gadget, and they've had access to pornography, different than what I had, access to. It was very difficult for me when I was younger and in my teens to see X-rated film. Oh, they have access right away, and they start based on research at the age of 12 or 13, even before they're sexually active. So they start formulating ideas of how sexuality happens,
Mhm.
and obviously these are not real ideas, right? And then they think their penis size is much smaller because the guy on the film is so huge, and my God, there's no way I can function with this, and all these things. So it's the number one problem in men, and not only younger men, but mostly younger men because they're the ones that are watching. But I've seen it in much older men as well. That's an issue. So that's the number one ED problem, I think.
And so that would be more psychological, it sounds like,
Right.
than actually
So,
physiologically.
it would be likely more physiological, but more psychological. But when it's a psychological ED for extended period of time, then it becomes physiological because if you
Hmm.
don't use it, you lose it as a muscle, right? And then it leads to depression. And then now you're getting overweight, and now you become more estrogenic. More estrogenic you are, less testosterone you make. So it's a downward spiral. Um, So then the second thing is guys that are um, kind of playing video games, and so and everything is easy. Have it too easy. So play video games. They're hungry. They order Uber Eats. Right. They don't have to move for anything, and so they're becoming overweight and again estrogenic, and that's the other issue. And then the third thing is stress because now, one would argue we've always been stressed, right? Why? What's different now? What's different now is technology. That in one way, men are able to, younger men are able to do better, perhaps financially. But in other ways, it's overstimulating, so it's affecting their sleep. You need good sleep for testosterone. You don't get good sleep if you don't hit REM. You're not getting, you're not making good testosterone. So I would say those are the big three: is porn watching, excessive being overweight from just lifestyle issues, and less sleep.
Yeah. Interesting. And I mean, so you bring up this metabolic health component, which I definitely think is, it sounds like it's this weaving connectivity between some of all of the discussions that we've had today and the importance of healthy metabolic health. And now that we know that unfortunately Americans are about 93% of Americans are metabolically unhealthy. How are you seeing this in your practice and what are you doing to tackle this?
Um, the way, so, I have a very interesting practice. Many of the people I see, very few people are just out of it and don't do lifestyle practices that I see in my practice. So I get very few people that starting from zero. So most of them tend to be metabolically okay. Now I do get to see every now and then one that's not, and I do get to see. I have a podcast myself, so I get information from those podcasts, and I know that is a huge issue. Um, and what you see is ED, right? So the penis is a barometer to men's health, right? So a man doesn't get an erection in one encounter, no problem. But he doesn't get an erection for 3 to 6 months. Those are red flags. There could be a psychological issue, but also metabolic dysfunction. So oftentimes it's a metabolic problem where their blood, cardiovascular lipid panel is very high. We talk about LDL, ApoB, all these things are very high. Triglycerides very high. Glucose, probably a lot of insulin, probably diabetic already, or leading, pre-diabetic. Um, 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 you know, uh, just poor circulation in general, high stress, poor sleep, all these things. So this is why it's important, even for female doctors, when they have a male doctor, to ask about erections, right? How often if any practitioners listening, there's a score that every patient answers for me called a SHIM score. Is a sexual inventory questionnaire. SHIM, SHIM, is a PDF. Downloaded. Every doctor should have their patients answer that. Um, so yeah, that's the kind of metabolic dysfunction I see. Oftentimes, again, they're coming to me because they're having ED. They're not
Right.
coming to me for wellness or anything else.
So we've touched on exercise and we've kind of pointed out the importance of weight bearing exercise and muscle building exercise. We've touched on nutrition and now you mentioned recovery and sleep as kind of your last bullet. Sleep for sure. I think most people are starting to catch on the length of sleep and how to prepare for sleep. But I'm curious, you mentioned recovery and sleep. So, are there other ways that you would recommend that your patients recover beyond sleep?
I don't want to undermine sleep for recovery. Okay, so we could, because then people, I know how men think. They'll grab on to whatever it is that they like. Oh, he said eat more protein. You know what? I'm just going to eat more protein
Yeah.
because I don't want to focus on the real problem, which is sleep.
Hmm.
The best format of recovery is getting the right amount of sleep, and not only the right amount, the right quality of sleep. For example, you could sleep 9 hours, but if you got 3 or 4 drinks right before sleeping, you could sleep 9 hours, you're not recovering, right? Or heavy meals and things like that before going to sleep. Very important to to get good sleep. I had a patient yesterday. He said, "Look, my sleep is like 6 hours. Do you think I could nap if I want to? I have the ability. Should I? But sometimes I don't feel like it." I said, "Go lay down for 10 minutes, and if you sleep, if you nap, then nap, and if not, get up." So sleep is crucially essential for recovery. I might even argue that that very few things are even close to that. That said, proper hydration. Now, when I say hydration, I don't only mean water, I mean also electrolytes. Particularly, it's hot today in New York. You're in California.
Yeah.
It's hot there most of the time.
Yeah.
So you need good quality, you need electrolytes. That you need some sodium, potassium, magnesium, and any good powder that you like. Just throw that in there in the water. So don't just drink water by itself. Have an electrolyte drink, not Gatorade or sports drinks. There's better qualities out there. I'm sure you guys will create one. I know you have a plant-based protein powder. I'm sure you'll create one soon. Um,
In the works.
it might be in the works. Who knows? Um, so that and then protein. Now, um, you need enough protein for recovery. I don't think I had a lovely conversation with Vulture Longo on this, and it brought some clarity. Um, Based on my research and experience, I don't think you need the gram per pound type of thing, but I do think you need at least a half a gram to zero point 0.6 grams per pound of protein. Vulture would love me to say from a plant-based diet. I don't care where you get it from. I don't care. I don't think you need to eliminate some animal products, certainly seafood and fish. Or if you're a plant-based, just make sure you get it from a plant-based product or plant-based foods or plant-based good quality powders. I don't care where you get it from as long as you get that amount.
Yeah, absolutely. And I mean, thankfully, I think we're now for most people out there, finding protein shouldn't be too hard, but it is, but there is still that aspect of quality protein. That's why L Nutra came out with the L protein that really does balance kind of
Pretty
that
good. It's pretty good.
it's good.
Look there again. I'm not anti-whey or anything like that, so you can edit this out if you have to.
I
It's
would never.
okay. But I just care about people getting the right protein in. Period. End of story. And when I look at plant proteins, I think many of them are not great because they don't have enough of the of things in it that have the 9 essential amino acids. That's what I care about. I have to say, I have to say, when I do recommend plant protein, it is the L protein because it is actually very complete, nicely done, and I wouldn't expect anything else from the company. I don't work for you guys. Can you tell people that I'm not paid to do this and I don't work for you guys? Can you? Because I may sound right like an ambassador, and I am, but I don't get paid for it. Can you let them know, please?
That's where we are so lucky that we have all of the research, all of the support, and that the company really does care about creating things that are so thoughtfully created and scientifically backed that you are thankfully one of many of physicians that are making these recommendations. So, but yes, I'll keep that in here so that the world knows that this is
It
your
is good.
honest.
It is very good, and trust me, I do my research, and it is very good.
Yeah, absolutely. Okay, well, I've kept you for long enough, but I would just ask you, is there any final pearls of wisdom in the world of men's health as an expert that you are that you feel like the audience should know?
Yes. So men, one of the reasons why men don't go see doctors is because they don't like to be in vulnerable situations. They don't want to have get the bad news, particularly, finger up the rectum and all these kinds of things. And I don't blame you. I don't blame them, and I don't blame you if you're watching. I get it completely. I do. Now, I would also say, and the other part is that there's trust issues with doctors, not only with men, with everyone, but certainly with men. Men are all about trust. You always hear the term, go to my guy. Hey, you need a bar. You say you need a barber? Go to my guy. You need a tailor? My guy. Dr. Mike, right? It's always my guy. These things insinuate trust. This is my guy. So it's all about trust. And there's trust issues with doctors. Again, don't blame you. I understand. Now, I would also say that ignorance is not bliss. If there's something that I've learned throughout my 23 plus years of practicing is that ignorance is not bliss. So you do want to find a doctor that there are a lot of good doctors that you can actually trust. So find them. It shouldn't be that difficult. There's functional medicine doctors. Sometimes there's even medical doctors that do things the right way. So you just have to try, and maybe you have to, it's like a dating app. You keep going through, one, the next, and next, and next, and next, and finally, maybe by the 10th one, you find a good one. But it's worth the effort because, again, ignorance is not bliss. You want to get checked up. You do want to test. Don't wait for symptoms. You can't say, I feel good, and then say, well, I feel good. Why should I go? No. I mean, I feel phenomenal at 52. Sometimes I forget my age. I mean, I feel better than I did 10, 20 once a year. I get blood work twice a year just to make sure that what I'm feeling is not different than what my blood work shows, right? I want to make sure that I'm healthy, not only on the outside, but more importantly on the inside. And I think that's a good takeaway for your audience.
Absolutely. And I hope that that has been made clear throughout the podcast from the very beginning of making suggestions of things that you can ask and ask early and go back frequently. I hope that the audience is able to take this home. But I think it's a nice little bookend here because if people are looking for somebody that they can trust, maybe that's you. Where can they find more about what you are doing, Dr. Gio?
And if it's somebody had said to me, look, you're only one person, everybody goes to you, what are you doing, like what's your legacy? I'm like, man, I'm only 52. I guess at 52 you got to start thinking legacy. All right. So eventually we're going to have courses where people get certified, and there'll be more people. But certainly I'll be very glad and honored to see anyone. drgeo.com, that's drgeo.com. Everything is there: podcast information, written material, and how to get in touch with a member of my office for scheduling or anything.
Fabulous. Well, Dr. Gio, as always, such an incredible pleasure to have you here. Thank you for letting us pick your brain for the last little while here. I'm sure that there will be many questions that come up from here, so we might have to have you back. So get ready for that. And again, thank you so much, and thank you to all of the listeners for sticking around with us for this lovely hour. And we very much appreciate you all too. Have a great day.
Hold on, thanks.